Feeling sad or blue is something we all experience at some point in our lives. However, some people may feel like they are always living under a dark cloud. For many, that's what it feels like to live with depression. Depression is a common condition that affects both men and women. However, some people may be more likely to develop depression than others. Risk factors include having a close relative with depression, other conditions like anxiety and substance abuse disorders, had one or more traumatic experiences when you were a child, and difficulty coping with ongoing stress or negative mood for a long period of time. People with depression experience chemical changes in the brain that can impact brain functions like planning, reasoning, concentration, and decision-making. These brain changes can also affect hormones responsible for emotions and energy, and typical hunger and fullness cues. These chemical changes result in the symptoms often associated with depression. Common signs and symptoms of depression include feeling sad, empty, or hopeless, having less interest in or not enjoying activities you used to enjoy, experiencing unintended changes in your weight, changes in your sleep patterns, changes in body movements such as restlessness or moving slower than normal, feeling more tired than usual, feeling worthless or guilty, having difficulty concentrating or making decisions, thinking frequently about death, or contemplating or planning to harm yourself. Symptoms of depression can become overwhelming and interfere with daily activities. If this is true for you, see your healthcare provider. If all other possible conditions are ruled out, you may be diagnosed with depression. In this case, you may be referred to a mental health professional for further assessment and treatment. It's important to note that grief or the pain caused by loss is not the same thing as depression. While many symptoms, such as emptiness or loneliness, may be similar, grief is a normal response to loss or death of a loved one. Depression is also not a sign of weakness. It is a long-lasting medical condition that is treatable. Treatment options for depression may include behavioral therapy with a mental health professional, attending support groups, taking medications, medical therapies such as brain stimulation or light therapy, lifestyle changes, alternative therapies such as acupuncture. Many people are able to manage their depression through a combination of treatment methods. Additionally, coping skills are a vital part of day-to-day management of depression. Often, depression may feel overwhelming and out of your control. Coping skills can help you feel empowered to take charge of your thoughts and feelings. Some of these skills can be developed by working with a counselor, such as realistic self-talk. This is a skill where you identify thought patterns that lead to depressive reactions and replace those thoughts with reality-based thoughts. Different coping strategies may work best for different people. These may include journaling. This may include keeping track of unrealistic thoughts or keeping a log of things you were thankful for. Meditation and yoga, exercise, spending time in nature, following a predictable routine each day, participating in activities that make you laugh, spending time with supportive people. Treating depression can take time. Work with your mental health care professional and primary care provider to determine the best treatment option or combination of options for you. It is important to regularly check in with your healthcare provider to discuss how your treatment plan is working, if anything needs to be adjusted, and any concerns you may have. Remember, if you ever feel like you may hurt yourself or others, or have thoughts about taking your own life, get help right away. Call 911, a suicide crisis helpline, or go to your nearest emergency department. Depression doesn't have to control your life. When you are able to find a combination of treatments that work best for you, you can leave the dark cloud behind and lead a healthy, fulfilling life.